Behavioral variant, FTD. The most common type of FTD is the behavioral variant, or bvFTD. The first and most notable symptoms of this variant will be changes in personality and problems behaving appropriately in social situations. bvFTD involves loss of brain cells or degeneration, primarily in the frontal lobe. The frontal lobe is the biggest lobe located at the front of the brain. There is a part of the frontal lobe at the very front called the prefrontal cortex. This part of the frontal lobe is important for skills related to thinking, emotions, personality, and social skills. It controls how well we coordinate and execute all of our higher-level cognitive behaviors or executive functions. This involves critical life skills like planning, decision-making, prioritizing, problem-solving, and more. When FTD affects the prefrontal cortex of the frontal lobe, a person will start behaving differently than normal. Common symptoms of behavioral variant FTD include the following. 1. Difficulties with planning, organization, and decision-making. 2. A lack of inhibition, so that they lose their filter and say things that they would normally keep to themselves. Have a harder time controlling their emotions and act more erratically or impulsively. Impulsivity can lead to compulsive behaviors in eating, smoking, and alcohol consumption, or risky behaviors including gambling and excess spending when they never did these things before. 3. Apathy, or loss of interest in usual activities and loss of emotional expression. For example, they might care less about their work, hobbies, relationships, and overall health. They may also have a flat affect and show reduced emotional expression. 4. Socially inappropriate behavior, like saying or doing inappropriate things and ignoring personal space or boundaries. 5. Lack of awareness of these symptoms, and thus anger at others when these symptoms lead to consequences such as failed relationships, job loss, and legal or financial difficulties. Because of these behavioral changes, people with behavioral FTD may initially be misdiagnosed with mental health disorders like depression, schizophrenia, bipolar disorder, and others. Researchers and clinicians are working hard to identify tests that can better assist with differential diagnosis between these disorders. Management of behavioral variant FTD may involve medications, lifestyle changes, and therapy. Sometimes, patients with behavioral FTD will be prescribed psychiatric medication like antidepressants or mood stabilizers to treat their symptoms. They will also be encouraged to make lifestyle changes to help promote overall well-being. This may involve improving their nutrition, exercising, and ensuring that they get adequate sleep. As behavioral FTD progresses, the symptoms described above will worsen. Patients will also begin to have more issues with their thinking and communication abilities. While all dementias are challenging for patients and their loved ones, behavioral variant FTD can be especially challenging because of the personality changes and the impact that this has on the ability to participate in social activities and relationships. Caregivers will need to seek out training for de-escalation and communication. Caregivers will also need to connect with support resources in their community to help them navigate changing relationships, manage their new responsibilities, and cope with the emotional and physical toll of providing supervision and care. Planning for future needs is crucial as the disease will progress. The person with behavioral variant FTD will eventually require full-time care to ensure their safety and well-being. It's important to consider options for caregiving, whether through family members, professional caregivers, or assisted living facilities. Legal and financial planning, such as setting up a living will or power of attorney, should also be addressed early to ensure the person's wishes are followed and to reduce stress on the family later on. It is important for a person with dementia and their loved ones to advocate for them to receive the help and services that they need. This will help them maintain their quality of life, overall wellness, safety, and independence for as long as possible. In summary, behavioral variant FTD is the most common type of FTD, characterized by early symptoms of personality changes and inappropriate social behavior. It poses significant challenges due to its impact on social interactions and relationships, necessitating proactive planning for the progressive nature of the disease.